Feline leukemia virus, or FeLV, is an enveloped RNA retrovirus that causes a spectrum of diseases depending on the viral strain and the host's humoral and cell-mediated immune response, ranging from no presentation of disease to acquired immunodeficiency, lymphoma, leukemia, aplastic anemia, and other myeloproliferative diseases. Although prevalence is low, FeLV exposure and infection remain a significant concern. Indirect transmission is unlikely, as the virus is fragile in the environment. It spreads via saliva, urine, feces, vertically, or via contamination. Kittens under 8 weeks are the most vulnerable due to their immune immaturity. Cats with outdoor access and in multi-cat environments have increased probability of viral exposure. Unvaccinated cats also risk FeLV infections without adequate humoral protection. And immunosuppressed cats, such as those with concurrent FIV infection, face a greater risk of severe disease.
Infection typically starts with viral replication in the oropharyngeal mucosa, which spreads to the adjacent lymphoid tissues, infecting lymphocytes and monocytes. The virus enters host cells to synthesize new virions and can also insert proviral DNA into the host genome, altering gene expression for continued viral replication. FeLV can manifest differently depending on the host's immune response. An effective immune response can completely clear the virus or just enough to retain the infection to certain tissues without it spreading. If not controlled, bone marrow stem cells can become infected to create more compromised hematopoietic cells. In regressive infections, the host mounts a partially effective immune response that keeps viral replication in check, but FeLV can reactivate upon immunosuppression. In progressive infections, the immune system fails to control viral replication, leading to blood disorders and immune suppression, with poor prognosis from systemic spread. And so, early diagnosis of FeLV cases is critical to prevent transmission and inform clinical management. Suspicious clinical symptoms associated with high-risk host factors should always be investigated. Point-of-care tests targeting P27 antigens are quick and easy to use in clinic, but can result in false negatives if tested before viral replication, and so initial tests should be repeated with continued retesting to improve diagnostic confidence. PCR is recommended as a confirmatory test of viral presence by detecting proviral DNA or viral RNA. However, false negatives are still possible, and repeated tests are needed to distinguish between infection types.
FeLV management centers on prevention without viable treatment. Vaccination from 8 weeks is advised for at-risk cats, though an indoor-only protocol offers the best protection. Cats should be tested before introduction, with positives quarantined and retested until viremia subsides. Positive cats should never be housed with naive cats, and co-housing with negative cats is possible if all are vaccinated. Progressively infected cats require strict housing to limit contact with naive and wild populations. Stress and immunosuppressive drugs should be minimized to prevent reactivation in regressively infected cats. And progressive cats require ongoing veterinary support as they cannot combat associated diseases.